And a very warm welcome to all of you this morning for the launch of my final annual report as Chief Inspector and also my final launch event. It's great to have you all with us today. We had well over 100 people signed up for today's event. This report covers the work, the publications that we produced between January of 2022 and July of 2023. And it focuses in particular on the aggregated results from our local probation inspections. And over that period, we published 31 reports on local probation delivery units across England and Wales. And this is the first time we brought together that data. The report also includes information, data, key findings from some of the thematic reports that we published over that period, including some important reports on MAPA arrangements, on rate equality, and on the supervision of domestic abuse perpetrators, and also on the supervision of terrorism offenders in the community. The report has a range of chapters in it, and I hope people have had a chance to read it. We'll put a link to it in the chat line, but there are chapters in it on our local findings, on staffing, on whether the needs of people on probation are being met, on public protection and resettlement, and you will hear more about each of those themes as we go through this opening presentation. We'll be speaking for about 30 to 45 minutes, and then, as Holly said, there'll be plenty of time for your questions, comments, and views. I would just like to start really by thanking everyone who has taken part in one of our inspections as we've gone around the country. As we say in every one of our reports, these inspections wouldn't be possible without the cooperation of frontline staff. We recognise we've had some very tough messages for probation services over the past year and a half, but we've always welcomed the chance to interact with all of you out there on the ground. And I hope that this presentation this morning summarises the results of what we found out from those discussions with you. And I do want to emphasise that all of the raw material in our reports is presenting back to the probation service what we've learned from discussions with staff and from our findings on the ground. So as I said, the key thing that this report brings together is the aggregated data from our local probation PDU inspections in 31 probation delivery units around England and Wales. For those of you who aren't familiar with the detail of our methodology, we spend roughly a week in each of these fieldwork locations, and we look at what we call two domains of activity. So firstly, we're interested in how well a local service is being led. We look at the staffing arrangements, we look at the services being provided, and at the sort of office accommodation that people are based in, the IT that they're using. And then in every area that we visit, we inspect a sample of cases. Simi will say a bit more about the methodology behind that, but basically we look at cases, we interview the relevant practitioner, and then we attach ratings or judgments to the work that we see in those cases. All in all, we rate 9 different standards in every probation area that we visit, and we then aggregate the results from those standards to give an overall rating to a service. One of the innovations that I brought in as a Chief Inspector is to ensure that there's a closer link between what we find in the individual cases that we inspect and the qualitative ratings that we give to the way a service is led or the service it provides. So in practice, if we find that less than half the cases that we inspect are satisfactory, which would mean an inadequate rating, that then makes it impossible to be given a good or outstanding rating on your leadership, and similarly the link with the services standard as well. Next slide, Holly. And there's no getting away from the fact that our ratings for local probation services have been disappointing over the past 18 months. The first local inspection we did was in South Wales, where the fieldwork was in the autumn of 2021, and we looked at Swansea and Gwent and published those reports in January of 2021. And then we continued around England and Wales. The last of our published local inspections was in the southwest and Bristol and South Gloucestershire. And you'll see from this chart that it's very little green on it. Only one out of the PDUs that we visited over the past 18 months have we rated as good, and that was Gateshead and South Townside. But there's an awful lot of red there as well. So in the 31 PDUs that we report on in the annual report, 15, i.e. half of them, we've given an overall rating as inadequate to, and half of them, another 15, have been rated as requires improvement. And you'll see from this bar chart that there really hasn't been an upward trend in performance. The scores have remained disappointing all the way through that period. So even though we're now nearly 2 years on, well, we are 2 years on from unification, we're well past the pandemic. Disappointingly, our scores haven't seen an upward trend. And when unification happened, I was very clear that that process by itself, that bringing services back into the public sector, was not going to be a silver bullet for all of the problems that we previously found in the probation service. Next slide. I mentioned that when we do a local inspection, we're interested in two domains of activity. Simi, in a minute, is going to talk about what we found in the individual cases that we looked at. This slide summarises what we found when we looked at these key aspects of service management and delivery. And those 4 columns on the right represent the 4 standards that we look at, including leadership, staffing, services, and information and facilities. And you'll see there's an awful lot of red in the services standard. 13 out of the 31 PDUs that we visited, we rated as inadequate on services. Much of that was driven by the poor data that we saw in the cases, and Simi will talk about whether we felt that people's needs were being met by services. Quite often we felt that they weren't. And then staffing was another big area of concern, and I'll say a bit more about what we found when we went through staffing. And you can see that where a staffing or a services box is red in the column, then that almost inevitably leads to an adequate rating for leadership as well. So that's the first domain of the things that we look at and our overall ratings. I'm now going to hand over to Simi, who's going to talk about how we rate individual cases and what that data showed.
Thank you, Justin. Next, thank you, Holly. So when we inspect PDUs, we take a sample of cases that started supervision in the community or released from prison approximately 6 months ago from the point of announcing the inspection. This includes people on community sentence, those released from prison, and also across the different risk classifications from low to very high risk of serious harm. And in this period, we've currently looked at over 1,500 cases. We have a team of inspectors. They will look at the case and make judgments about assessment, planning, delivery of the sentence, and the reviewing activity that took place in that case. We consider the quality of work in relation to engagement, so how well are practitioners engaging with the individual, the work undertaken to encourage desistance, and the work to assess and manage the risk of harm to others. In those areas that I've just described above, there are 12 questions against which inspectors will make a judgment as to whether the quality of work was sufficient or not, and that's considered on an individual basis. As well as reading the case material that's stored on a case management system or an assessment tool system, we also undertake interviews with probation practitioners as and when they are available. And this is a person that's primarily been involved in the case. And if they're not available, we tend to look for a substitute or somebody else that knows the case. And what that allows us to do is capture anything that's not been clearly recorded, but also hear about their experience of working for the organisation. Next slide, please, Holly. So what have we found? So across the questions we ask in relation to assessment, planning, delivery and reviewing, there was no element that was being delivered sufficiently well across all of our inspections in England and Wales. This was the case in over 62% of the cases that we looked at, and that was 1,509 during that relevant period. And in only 3 PDUs were more than half of the cases sufficient against the worst scoring question, which was the assessment of risk of serious harm. Generally, we're finding that practitioners were stronger in engaging with people on probation. And that's often included positive evidence of them talking to them about their assessment, taking into account their individual needs and their personal circumstances. However, a key concern for inspectors was this was not following through when they were considering the risk of harm that was posed and the factors that were driving the ratings of inadequate and requires improvement was a work around the risk of harm. To illustrate this, we often found that information about a person on probation was not being analysed on an individual basis. There were an absence of home visits, and working with other agencies and supporting and sharing information effectively wasn't always taking place. Next slide, Holly. And on this slide, it illustrates further again what we found. So risk of harm was consistently scoring the lowest across all areas of supervision. However, even in stronger areas, they were only achieving 62%, which was the reviewing of engagement activity. And the next slide, Holly. And the findings are actually showing that since unification, the scores have got worse when compared like for like against the PDUs, and the findings from the previous round of CRC and MPS inspections when they're combined. We found a similar pattern in our inspections of enhanced through the gate and of which CRC is responsible for, and with court work that the MPS responsible for. Again, the delivery was better then than what we are seeing now. Next slide, Holly. Worryingly, there are similar themes that are coming through in our independent reviews that we've conducted. So in our independent reviews of Damien Bendel and Jordan McSweeney, we outlined that there were serious deficits in relation to the management of the risk of harm they each posed. And yet these are some of the same issues that we're finding in the cases that we're inspecting as part of the probation inspection programme. And these cases are a stark example of what can happen when things are missed. With on 3 out of the 31 PDUs assessing a risk of harm sufficiently in over half the cases inspected, it's worrying that sufficient plans were not in place to manage the harm posed and protect known or even actual victims, potential victims. Some of the critical concerns that we found was that we have is that risk of harm was assessed incorrectly in 15% of cases, and that's despite information being held by other agencies such as police, children's services. In too many cases, inquiries just weren't being undertaken and information weren't being shared properly and sufficiently. The concerns were when the risk of harm posed was actually higher than what was being assessed, and that then impacts on how the management of risk is then undertaken. Next slide, Holly. So when someone is assessed to pose a medium risk of serious harm, this means that they can cause serious harm, but there are actually protective factors in place, which means the likelihood of that happening is somewhat reduced. However, a large number of serious further offences are committed by those assessed as medium risk of harm. And that is where we found the quality of supervision to be the lowest, which you'll see in the data shown in this slide. Next slide, Holly. From April 2021, we started to provide an independent oversight quality assuring serious further offence reviews that were completed by the regions. And in the last year, we quality assured 86 reviews, and we were asked by the Secretary of State, as mentioned, to undertake a number of independent reviews of the 2 cases. As with our probation inspection programme, this work has found that the risk of harm posed is underestimated and means that the right plans were not in place to manage the risk and put in place contingencies should things escalate. And when there were concerns about compliance and engagement, we found that enforcement action, particularly that around recall, was not being undertaken. And this then raised the question that had enforcement action been taken, could that have led to a different outcome, which are some of the questions that we're often asked when we meet with the families of the victims of the serious further offences that we've conducted an independent review on. And while engagement was one of the areas that probation performed better in, when looking at the SFO reviews, and in particular that of Jordan McSweeney review, diversity factors weren't always sufficiently being considered, and that impacted on accessing specialist support in that particular case. Now, no one case should or can be managed in exactly the same way as another, and that requires the use of professional curiosity to understand and analyse what one thing means for a particular individual and how that should be managed. However, what we found was that there was often a lack of professional curiosity being applied. We also found a gap in the delivery of necessary interventions to support desistance and to address the harm that was posed. In situations where access to group work was not possible, we weren't seeing alternatives such as toolkits or other interventions being delivered, which meant that sometimes the contact with people on probation was either unstructured, it wasn't focused on either reducing reoffending or addressing the harm posed, and often reflected what we term as a check-in style session and not undertaking the necessary work. Next slide, please. So when assessing the work to meet the needs of people on probation, we found the quality of work had reduced since unification. This was illustrated by the outcomes for those with accommodation needs and support provided for those, for example, with drug misuse problems. Despite millions of pounds being invested in commissioned rehabilitative services, we've often seen a lack of referral to some providers or an over referral rate than expected to other providers, and some services such as accommodation lacking in being able, the accommodation provider lacking that ability to provide actual direct access to housing for people on probation, which practitioners often then avoided referring into because there wasn't a clear outcome available for the people they were referring. Next slide, Holly. So the data on this slide reflects yet again that reduction in quality now compared with the inspections from the CRCs and the MPS. So recovery from COVID was difficult for many providers, with them being unable to offer services during the pandemic and then struggling to get back to normal delivery. Again, I mentioned before that we've heard from practitioners that they often tend to try and deliver the services themselves rather than using the CRS provision, mainly due to the lack of outcomes achieved, or they tend to use other local services with whom they may have established links with. We also found, similarly, the delivery of the offender management in custody inspection, as Helen may report on later in a recent thematic. Services were not being delivered very well, despite having improved when the CRCs were responsible for the enhanced through the gate services. And while services were better for women, it was considerably worse for people from ethnic minorities. So I'll hand over to Justin now, who will cover the next stage. Thank you.
Many thanks, Simi. One of my priorities when I became Chief Inspector was to give more of a voice to the people on probation about their experiences of being supervised. We started off with our thematic inspections and worked with a range of partners who were able to provide interviewers with lived experience to interview people on probation. That gave us some very good insights and evidence for our thematic inspections. And then from March of 2022, we've also introduced this element to our local probation inspections, and we've got a 3-year partnership with the organisation Use a Voice, who provide interviewers on site with lived experience in each of the PDUs we visit. They do a survey of everyone on probation in the caseload to give people a chance to offer views. They sit in waiting rooms and try to interview people, and they through that combination of quantitative evidence but also some very powerful qualitative quotes, we get a really good rich picture on what the experience of probation supervision is for people who are actually on probation in a local area. Just a couple of slides to illustrate what's come back from this. So we ask a set of questions about people's access to probation staff themselves, their feelings about being supervised, what it felt like to go into the office. And in general, this, I think, was a reasonably positive picture, actually. So, for example, nearly 80% of the people that Use a Voice surveyed said that they were being offered appointments at suitable times. 85% of people felt that they felt safe when going into a probation office. Slightly lower figures in relation to whether people felt they were having to travel too far to get to an appointment, or even on on this question, only 14% of the people user voice surveyed said that they, or disagreed that they had a reasonable travelling distance. Although we did find examples of people who felt they were travelling a very long way and at great expense, but were only being seen for 10 minutes or so when they got to the office, and it felt more like a check-in than a proper appointment. Next slide. The other thing that we ask people on probation about is whether they feel that they are getting the services that they need to deal with the underlying problems they may have that may have been driving their offending behaviour. You'll see from this chart that the responses to this set of questions were slightly less positive than the previous set of questions. Only just over half, 53% of the people surveyed felt that they did get access to services that were relevant to their personal needs, for example. Although you'll see that there's a large chunk of people, up to nearly a third, who didn't really offer a view on whether they were getting services or not. And I think there's a job to be done to work with people on probation to identify those needs and help them to recognise that they do have needs and do need help meeting those needs. Next slide. Probably the biggest issue underlying our findings in relation both to the poor quality of work being done around public protection and risk of harm, but also the failures to properly assess needs and to meet those needs relate to the huge staffing challenges that probation has faced in recent years. And pretty much every area that we visited, we found great problems with staff vacancies and also high sickness rates. So although they were particularly pronounced in London and the South East, that certainly wasn't the only part of the country where these things were being experienced. National data from March of 2023 that we quote in the annual report shows that almost 30% of probation officer posts were vacant at that point. In London, the figure was nearly 35%. And in some of the local PDUs that we visited on our inspection, we were finding vacancy rates of over 40 or over 50% for some key grades, like probation service officers or POs. The good news is that there has been a concerted drive to recruit more probation staff, and I really welcome that. The service set itself a very challenging target of 1,500 trainee PQIP officers being recruited each year, and they have hit that target. And as of March of this year, there were over 2,600 probation officers in training, PQIPs in training. That training takes a while, depending on what your background qualification is. It can take up to 21 months to complete the training and become a newly qualified officer. But those 2,600 trainees, provided that the service manages to keep them in the service, will start to plug the vacancy gaps that we've been seeing. And in more recent inspections, heads of service have been telling us that they expect to be up to their target headcount level by the spring of next year. Having said all that, it's clearly vital that the service holds on to not just new trainees, but the more experienced staff as well. And there has been an increase in the number of people leaving the service. There were 2,000 staff who left probation service last year. And the most worrying thing is that it's the people with greater experience that are leaving. So 2/3 of the probation officers that left last year had over 5 years experience. And that means that newly qualified or trainee staff have fewer and fewer more experienced colleagues around them to mentor them and to guide them in their work. As a result of vacancies, but also as a result of the high sickness rates for people who are in post, we're continuing to find that staff are saying that they feel that their workloads aren't manageable. And even though we've got good evidence that actually average caseloads have come down since unification, particularly for staff that were working in CRCs, where it wasn't uncommon for us to find PSOs with caseloads of 70 or 80, probation officers with caseloads over 50. We're not seeing those to nearly as great an extent now. In spite of those reductions in caseloads, over 60% of probation staff that we're talking to still feel that caseloads aren't manageable. And actually, particularly for probation officers, that figure seems to have gone up. when you have a very high number of inexperienced or new staff, it's obviously really important that the supervision that they're getting from senior probation officers, from middle managers, is as good as it can be, so that they're being properly mentored, that mistakes are being picked up and corrected. And it was very concerning, I think, to find that actually that supervision isn't happening to nearly good enough quality. So you'll see there over 70% of the cases that we inspected, we didn't feel that the management oversight from the SPO was effective. And in some cases, it seemed to be absent altogether. I mentioned the sickness rates. I mean, they are quite shockingly high in some areas, almost 17 days on average per probation officer being lost in London as a result of sickness in recent statistics. And very worryingly, half of those days are being lost because of mental health or stress related reasons, which I think shows you just the pressures that frontline staff are under at the moment. I did just want to mention blended working, because I know some of the press coverage of our report did focus on that on Tuesday. We did mention, I think in passing, that blended working meant that when staff are only in the office for 3 days a week, that does limit the time that they have to do face-to-face appointments, and it also means that staff have less contact with colleagues or managers, and we queried whether that was affecting the quality of work that was being done. But that certainly, I don't think, was our main finding, and I wouldn't necessarily see that as the main driver of what we found in our inspection work. Right, I think we're now going to hand on to my colleague, Helen Davies, who's going to talk you through what we found in relation to resettlement.
Thank you, Justin. Next slide, please. So, as mentioned, we did look at the OMIC model and resettlement in 2 of our thematic inspections, and you will know that the number of people supervised post-release has increased significantly since 2015, so up by 56%. And what we look for in terms of pre-release planning is that the prison-based probation staff have addressed those practical needs of accommodation, of substance misuse, mental health, for example, and the continuity of care in terms of those needs, as well as of course, risk management and making sure that there are appropriate licence conditions in place. And what is absolutely key and came through in our work was the timely handover, so that handover process from the prison-based to community-based probation staff, and that then when in the community that the same standard of supervision is expected for cases post-release as for other types of order. So that's what we look for. Next slide, please. And our findings are disappointing, similar to what we've heard earlier in terms of the quality of supervision, the same essentially for post-release cases. And this is data from our core inspection programme. Next slide, please. So specifically in terms of the work that we did on OMIC with jointly with HMI Prisons, where we were able to follow a sample of cases through from prison into the community. We went back 6 months later to see what had happened to those people who were due for release when we saw them in custody. Our overall finding was that there are serious flaws in the OMIC model, and staffing shortages played a key part in this, with it being at crisis point in some prisons in particular, but also lack of communication between staff and confusion between the different sorts of roles under the OMIC model. Colleagues from HMI Prisons looked at the key work function in prison and overall found it to be poor, and it wasn't connected to the offender management function either. And worryingly, only 35% of people in custody that we interviewed had been seen by their key worker in the past 6 months. The probation officer, the new role, the probation offender manager in prison, we concluded sadly that currently it wasn't adding value. And that's because there was too little contact with prisoners. 64% hadn't seen their POM or had seen them only twice in the past 6 months. And also insufficient work was being done with them to prepare them for release. Not enough interventions, accredited programmes, for example, running. And then to the handover, where we found that that was effective in only 40% of cases, and worryingly, a number of people in custody were left in the dark about who their offender manager was. They didn't know who was supervising them, sometimes in custody and then on release through to the community. Next slide, please. So, as I said, we followed up 6 months later and found that of those cases that we saw in custody, 1 in 10 had been released homeless. And 60% were released without settled accommodation, maybe not street homeless, but without settled accommodation. We did, however, flag the impact of CAS 3, post-release accommodation, in those regions where it was available at the time of the inspection. The outcomes were better, so that is encouraging. There was also some improvement in employment, from 6% at the point of release up to 33% at the point of inspection. Although still a low number, there was some progress noted. Services to meet drug misuse were delivered in only 24% of cases, and for alcohol problems in only 32% of cases. And that is really concerning, especially for people coming out needing detox in the community. That continuity wasn't there. Similarly, for finance, benefit and debt services, they were delivered in only half of the cases where we felt it was needed. Commissioned services have been mentioned before, and providers we found couldn't access probation records, for example, to get that up-to-date information on risk or contact, and late referrals of high-risk cases to approved premises, lengthy referral forms as well to get into approved premises were a barrier, and often we saw work being done at that last minute, so people didn't know where they were going to be released to. Next slide, please. Now, I did want to end on an optimistic and a positive note. So one of the our recent inspections we did jointly with the Police Inspectorate and the Prison Inspectorate, and we looked at counter-terrorism. So for probation, the work of the Security Division, and our findings were very encouraging, and for a number of specific reasons, we think. Firstly, probation, police and prison services had worked well together in all of the cases, and there was good information sharing arrangements in place and regular discussion between the agencies. Supervision in the community was robust, and there was that balance that we'd expect to see with tight risk management and also addressing rehabilitation needs in the community. Probation practitioners were well trained, specialist in role, and I think importantly, they held only a small and restricted caseload so they could focus time and be able to engage in the multi-agency work that's so important. The people on probation were subject to additional oversight, of course, as you'd expect throughout their sentence, and that helped with the supervision of those cases and was seen as to be supportive to the probation staff managing those cases. They didn't feel that they were on their own. And of course, it has to be recognised that in this area of work, there has been significant financial investment to improve services in dealing with counter-terrorism, and the staffing levels were appropriate. Important points to make, but a very encouraging inspection. And I'm handing back over to Justin now.
Many thanks, Helen. On to the final 2 slides now. So next slide, please, Helen. So just to give a bit of an overview, there's no getting away from the fact that this has been a very disappointing final report for me. We've seen a probation service that is very clearly struggling in more or less every part of the country. Our results have been very disappointing. I really wasn't expecting at the point of unification that we would be reporting a half of PDUs as being inadequate. And actually, as these slides have shown, the quality of individual casework we're seeing, particularly around the assessment and management of risk of harm, has actually got worse since unification, and there's no sign of it getting better. So the disappointing thing is, although you can understand our early post-unification inspections being very affected by the impact of pandemic and the impact of the transition between the TR arrangements and a unified service, 2 years on, our results are just as disappointing as they were. Our most recent PDU, we were still finding only a third of cases being assessed adequately on risk of harm. So no, disappointingly, in spite of more staff being recruited, in spite of coming out of the pandemic, no real signs that there's been an improvement in the quality of work that we're finding on our local inspections. Chronic staff shortage is still affecting performance, but as vacancies are filled, I think we'll increasingly see that the issue isn't necessarily about services not being at target headcount. It's about the balance between the number of very recently recruited and inexperienced staff they have and the more experienced staff and managers that they need to mentor and properly support those staff. So I think an increasing focus will be needed on that quality of management supervision. And in recent months, we've been doing a really important thematic on the role of SPOs and management supervision, and we hope to publish that later in the year. Having said all that, I think we do have some examples of what good can look like in probation work. Helen flagged at what we found in relation to terrorism or TACT offenders, where the target caseload is 12 cases per probation officer, as opposed to 30 or 40 that we're more typically finding in PDUs. And if you look at youth offending services, which we also inspect, a very, very different picture there. 70% of the youth justice services we inspected last year, we rated as good or outstanding. We haven't rated youth justice services inadequate since the spring of 2020. And if anything, their performance seems to have improved over the pandemic period. And I accept the fact that they are managing much smaller caseloads. A typical YOS caseworker may only have 7 or 8 cases to manage. But I think it's not just about small caseloads. I think it's also about the way that YOS services are organised. They are local, they are embedded in children's services, they are very multi-agencies, they have a very useful management board bringing together all of the relevant statutory agencies that can really escalate issues and deal with issues that arise in their caseloads, and that's been a really powerful local model. They can also innovate locally as well, and we see great variations across the country with YOS heads of services trying different things out, working with different voluntary sector partners in a really successful and interesting way. And so in my introductory essay to the annual report, I say that I think it's time to look at a more local model for probation, to return the probation service to being, as it has been for the great majority of its history, a locally governed service. I looked at a National Audit Office report, an NAO report published in 2013, which summarised the performance and inspection findings for the 35 probation trusts that existed before transforming rehabilitation. In terms of the performance assessment of those trusts by what was then NOMS, all of those trusts were rated as either exceptional or good in terms of their performance. And in terms of the Inspectorate's case assessment findings, 75% of the cases that the Inspectorate looked at, it rated as sufficient in relation to the management of harm. So a very different picture in a more local service. And I therefore think it is time that we had an independent review to look at whether probation should return to being back to being local. Right, we have got plenty of, sorry, can you go on to the last slide? I've covered most of this just now, but that's basically summarising what I've just said. So a strong argument, I think, that we need to think again about a more local service and the chance to learn from youth offending services. Right, that is the end of our presentations. I hope you have enjoyed that all. We have plenty of time for questions, do have a look at the full reports on the website. If you'd like to ask a question, do put it in the chat line, or else raise your yellow hand and we shall come to you. We have 112 people dialed in. I can't believe that none of you haven't got any questions on what you've just heard. Great, we've got one. Anne, what's your question? Can you hear us, Anne? Are you able to ask your question?
Can you hear me?
Yes, you can. Yeah.
Oh, great. Hi, I'm Anne King. I'm a national NAPA rep. I've got a question around, it's particularly a couple of comments. One that was made in section 40, the SFO section. You state that the reason that we focus so much on risk of harm, serious harm, is that poor practice can lead to tragic consequences. I'm really concerned at sort of giving the impression that there's a causal link between poor practice and some devastating crimes. I don't think that's helpful to the public either. That the people responsible for the offending is the offender themselves. And I think if you're making judgments like that, you need to also be explicit about where an omission or a commission of something would have, significantly altered the course of events. So I think there's a difference between identifying inadequate practice and saying, that directly led to a serious further offence, which is almost what's being implied. Just, be grateful for a comment.
Yeah, no, thanks for that, Anne. I mean, I think we, as Simi was saying, in the course of our work, we now review the quality of serious further offence reviews in 20% of those reviews. And in the course of doing that, we obviously look at the analysis of what lay behind the serious further offence. I mean, of course, you're right. The ultimate responsibility for serious further offences lies with the person committing that offence, and that's absolutely true. And it's impossible to say whether deficits in practice causally led to those incidents. And in some serious further offence reviews, it's found that there was very little else that the probation service could have done, or it may have been another agency that was at fault. But having said that, there are serious further offences where there were really worrying areas of practice. The Damien Bendel review that we did was an example of where we found a level of practice which was far below what we felt was acceptable, particularly in relation to an original court report. So it's amazing. But I think the other point I want to make is what we've also flagged in both the Bendel and McSweeney report is the much bigger systemic issues that lie behind some of these things. So in both of those reports, we point to the high caseloads, the poor practice around case allocation to some very inexperienced or only newly qualified officers who should never have been allocated cases in the first place. Very, very heavily overloaded SPOs in some areas, with sometimes 20 or 30 pre-quips they're expected to keep an eye on, and really weren't able to do supervision in the way that should have been managed. So there's a whole range of systemic issues which I completely recognise do lie behind some of these SFOs. Semi, do you want to come in as well? Are you on mute? Yeah.
Yeah, it was just to illustrate the same point that you've made, really, more about the workloads. And what we do is try to look further in terms of some of the why that sits behind some of the findings. Spans of control has a massive impact on managers' ability to provide oversight, to undertake the work that they're required to do as well. And that was an area that we did try to draw out of the independent reviews that we looked at.
Thanks for that, Simi. I think I'll alternate with some questions in the chat line as well. So, Sean, you ask how likely will service users have accommodation be made in priority in Hull? I'm told prisons are no longer a priority due to pressures on the housing stock. I mean, I don't know, Helen, do you want to reflect? We did see that where the CAS 3 service is in place, that is starting to make a difference, but it's clearly such a huge driver of potentially reoffending.
Indeed, we did see a difference. However, it was for a limited number of days. Of course, I think it's 85 days or something like that, isn't it? So while that's encouraging, we're still faced with a problem of what happens with people's accommodation after those days. But certainly it did help in those regions, and I think it's been rolled out more widely, and we did welcome it. But there's still the what then happens at the end of that period, in a similar way as to what then happens when the approved premises period finishes as well.
Thanks, Helen. Yeah, so I think it's all very well sorting out the first 2 or 3 months of accommodation for someone coming out of prison, whether that's through CAS 3 or an AP place, but that doesn't solve their longer term issue, and that's really, I think, where the problem will start to go to. Dion, I think you were the next to have your hand up.
Hello.
Hi, Dion.
Hiya. I've just got a quick question about the PQIP training programme. I'm a qualified probation officer in West Midlands. I just wanted to know, I came in a little bit late. Did your inspection include looking at the actual the course content of training the PQIPs? Because I know that retention of trainees once they qualify has been quite poor as well. So people are qualifying and not staying in the job, or they're not getting through the actual program, and there's been a lot of complaints about how the program's actually structured and delivered. But I know years ago, to qualify as a probation officer, you trained as a social worker, and then your last year of university you then specialized in probation practice, so you was actually an accredited professional. And that's changed over the years, where probation have designed their own program. But the program seems to be quite problematic with people actually getting through the course or staying after. So I just wanted to ask if your inspection included looking at the actual program, because staffing issues are one of the biggest issues with obviously caseloads and things like that. We need qualified probation officers, but retention, the retention rate for trainees as well is quite poor. And that is, we do need qualified probation officers. So I just want.
Thanks, Dion. Simi, do you want to answer that? We interview a lot of PQIPs, don't we, when we're out on field work?
We do, Dion. Yeah, we speak to staff about their experience, about how equipped they feel to undertake the role that they do. We haven't specifically looked at the PQIP programme, but what we are making judgments and comments about is the quality of training that's available and the ongoing support that's available to people as well, particularly whether that's through management oversight or through peer support. But training is certainly a theme that's emerged from our recent inspection programme, and maybe something that we might look at a bit further as we go. We'll also have an opportunity to start our new inspection programme, so we can almost look at an element of comparison in terms of what we were seeing in our last programme to what we're seeing in the current programme. But we have made numerous recommendations throughout various inspections that training is one of the areas that needs a bigger focus. Training, we know, is delivered at a national level, and then there's elements that are done regionally and more locally as well. My understanding is that there is a review taking place, but what that looks like at this stage, we haven't seen.
Thanks, Simi. Ian Lawrence. Ian.
Hello, everybody. Thanks, Justin. I was having trouble getting my microphone sorted, but look, thanks again to yourself and your team for the excellent work you have put in to create this report. And knowing you as I do, I'm sure you'll be disappointed that as it's your last report, it paints such a bleak picture. We totally agree. And what we've been saying already to senior managers and politicians is it's just like we've been saying the last 2 years. And it gives me no pleasure to say that, because what I think you've done, I've highlighted the key issue, or two key issues that we're facing at the minute to try and reinstate the service to anything like it was. One being taking it back into our communities, removing it from the grip of HMPPS. It's an excellent recommendation that we're all on all fours with. The other area that worries us as trade unions is that the department is running towards this one HMPPS program, and I think you reference it in your report. And we agree that probation needs time to breathe, and it needs an immediate review, not one that we can agree to and takes place 2 years down the track, because we're worried about the impact on our service level capacity by way of one HMPPS. So I'll leave it there. They're familiar arguments that you're aware of, but I thought I'd share that with people. Thank you for the opportunity.
Thanks, Ian. I do in my introductory essay also talk about some concerns I also have about one HMPPS. In particular, I think at the time that there was a Director General for probation, I really welcomed the fact that there was that dedicated, very senior leadership, which that post has now disappeared. And it does seem extraordinary to me that you have a service with over 20,000 staff, a budget of over £1 billion, 170,000 people being supervised in the community, but no Director General level leadership for it. So yeah, I have raised concerns about that as well. On the chat line, Kelly, interested in the lived experience feedback and positive this is now included. Were there any significant discrepancies by PDU? Kelly, yeah, we do release this data with each of our local reports, so you can see that. And there were PDUs where the feedback was less positive, and they did tend to correlate with where our ratings were poorest as well. So I think that was a good sort of triangulation, really, of against our own findings, was to be able to ask people on probation themselves about their experience. Going back to the hands. Who was next? Mike Nellis.
Thank you very much. Can you hear me okay?
Yeah, I can hear you, Mike. Yeah.
Okay. So I'd like to make a general observation about the quality, the high quality of the report. Dismal as it is and sad for you, I echo all of that, but I do commend that you've put that out there and you've framed this with both big and small arguments about how things might go forward. And I too welcome the idea, with one slight reservation about shifting back to community, in that it is yet another reorganisation. And we know from so much experience now, you've told us before, of how damaging chaotic reorganisations can be. But we must get back to that local level. We must do that. But how one does that and preserves practice in the midst of, a vortex of changing systems, to kind of phrase from the past, that's going to be a challenge in itself, but we do have to do it. My practical question, and it's not something you've alluded to at all, but I'd be interested to know, now that there is a lot more electronic monitoring about, particularly in resettlement, what you think about the integration of electronic monitoring into probation practice, because that has been a perennial difficulty with a handful of high points over the years. And I just wonder where you think the integration of electronic monitoring into probation practice is at, and whether it is actually adding value, because certainly it figured in the Bendel case and seemed to have made absolutely no difference whatsoever, right? It's a total negative. And any discussion of these serious cases, where electronic monitoring is an element of it, I think that needs to be acknowledged and a point made about whether it was useful or not.
Yeah, I mean, I don't know, Mike, you probably know that we did a dedicated thematic inspection of electronic monitoring, which we published at the beginning of last year. And I think one of the key findings with that was it wasn't properly integrated into probation practice, and that probation officers weren't making the use that they could have done, particularly of GPS location tags when they were doing their work. There's quite an involved process for them to actually get that mapping data back off the provider. There was quite a slow turnaround. It could take 24 hours even for quite high risk cases to actually get the mapping data. And so they weren't really using it, I think was the conclusion. And we made various recommendations about improving integration by making available that sort of information in a much more live and real-time form on the desks of probation practitioners. And I think that has now been built into the spec for the tenders that have been launched for the new providers. But I think there is potentially huge value from better information, particularly on location tracking. I think the alcohol tags seem to have been a positive development. There seems to have been some good evaluation data on those. So yeah, I think it can be a useful tool, but it needs to be used properly. And the Bendel case was a really good example of completely inappropriate curfew condition. For Bendel to have actually been curfewed to the house of his eventual victim was a disastrous thing to have happened. I mean, you could argue that actually what should have happened is he should have had a GPS tag to stay away from the house of his eventual victim. So it's the sort of how you integrate your planning around compliance and risk avoidance with the tools that you have to enforce those plans, I think is the key issue for me. John Mason is asking, it says, OMIC represented a significant shift of resource from local to services to prisons, with a large number of experienced staff moving into prison, either inspired or exhausted by field work. Do your inspection findings not imply that OMIC is a failed experiment and a return to localism would be supported by a critical review of the model? Well, I think one of the things our thematic has led to is quite a fundamental look at whether the OMIC model is working properly, and they've allocated someone to do that as part of their action plan. That was certainly one of our key findings, was it needed a pretty fundamental review of not just the role of prison offender managers, but MOMIC more generally. I'm not sure we've seen any Helen, have we seen any more outcomes from that review?
As yet, but there is an OMIC recovery programme ongoing, and 12 months from publication we'll be getting an updated action plan, and we'll expect to see improvements in line with our recommendations.
Thanks, Helen. Bernadette, you had a question.
Hiya, Russell. Sorry, Justin. It's more of an observation, really. I'm a frontline worker in Lancashire, a probation officer, and have been for 20 years. So I've seen lots of changes, and as a frontline worker, I can pick up on many of the nuances of practice. There were some things that I wanted to raise, and I know everybody is aware of them, but it's just to put it out there that the complex form filling that we have to do for every single task and every single agency, including our own agency for AP referrals, when somebody goes into AP for intervention services, surely we should all be, we are working off the same systems, and there should be a facility within that system to draw the relevant information together so that the relevant people in the agency, in the organisation, can pull the information, rather than us to go through the laborious tasks of filling it in every time we want to work on a case. And also the CRS communications, I think, are especially poor. It's a link we have to click on. It's meaningless. My email inbox ends up with probably hundreds of links every time the action, and it's overwhelming, and it's meaningless. The other thing, really, I suppose, is a question to go out there, is about how relevant is the probation service in the light of society as it is now, how much it's changed, certainly in the time that I've been in probation, and how realistic is it that we can be effective in managing risk and rehabilitation. We're looking at people, we're working with young people who have been born into mobile phones and social networks, etc. And I just wondered, how our service will change in the coming years to reflect that.
Thanks, Bernadette. That's a very big and important issue that you've raised there. I mean, I think there is a fundamental issue for me about what actually is the role of a probation practitioner. Is it to be a referral agent, to just sit there and do assessments and then refer people on for other people to do the interventions work or provide the practical support? Or is it someone who can be a change agent in their own right and deliver some of these interventions themselves? And I'm not sure that probation staff are very clear about that anymore, or even whether the probation service is clear. When you look at the contrast with youth offending services, where case managers have far more time to work with the children on their caseloads and to spend time doing interventions, to spend time working with them on their practical issues, I think it's a far more satisfying job for them. We see far more stability in terms of YOS staffing groups. I've been out and visited YOS where case managers have been in post 15, 20 years and are just as enthusiastic about the job as they always had been. So I think there's a lot you could learn from YOS about how satisfying you can make case management if you give people the caseloads and the resources to be able to do that. On your first point about paperwork, absolutely couldn't agree more. One of the recommendations in our OMIC report was that the AP referral forms were far too long. I think we found there was 16 pages of information you had to fill in, much of which could have been pre-populated from other case records. So there's certainly room to have a much more intelligent case management system that does all that routine pre-population work for you. I know there's a lot of work being done now to think about a redesign of both Andelius and Oasis, and not a moment too soon, really. I think a lot of people working in Thames Valley and London probably regret the loss of the Omnia case system, which felt like a far more intuitive system to people who were using that, and show what could be done if you invested in IT innovation, I think. David Breakspear.
Thank you, Justin. And I just want to second what people have been saying about the quality of the report, and sadly, the depressing aspect of the report as well. And speaking in my role as lived experience consultant of revolving doors, where we're concerned with obviously people who are trapped in the revolving doors of crisis and crime, and therefore more likely to be serving short-term sentences. I noticed the rise in post-release licenses, 56% rise in post-release licenses, which I'm going to assume is due to those serving 12 months and under being given those licenses. So therefore, with the reoffending rates of people serving 12 months and under still at an extremely high rate, is it time to rethink that process and come up with a different way to enable people to be supported more in the community following a short-term sentence?
Well, it's a really good point, and I think one of the issues with the OMIC model is it doesn't really cover that short sentence population. So you're now seeing dedicated short sentence teams, I think, being set up around the country to try and work with them, and that's made the landscape even more complicated now, because you have teams that are actually in prison trying to sort out people's practical needs afterwards. You've got OMIC caseworkers, you've got short sentence teams, and it's become a very confusing world. I mean, I think the emphasis should be very much on sorting out the practical things that people need. They need accommodation, they need help with finance and benefits, people need some form of identification, they need a bank account. These are really basic things that you struggle to survive with beyond a few days out of prison unless they're sorted. So my strong prejudice is that should be the absolute focus for initial resettlement work to get people back on their feet again, and that's why I think, as we said, a pretty fundamental look is needed at that OMIC model and who it's helping. Question about victims. Regarding victims, do we know the proportion of those who take up the VLO service as opposed to the total number of eligible cases? Well, Helen, I know we've got a thematic coming out at some point on victims, haven't we?
We have been doing a joint piece of work with the other inspectorates, police and the CPS inspectorate on victims. I don't know the exact figure there, but to say that report will be coming out. And we also look at the victim contact scheme, of course, on our core programme. So we will have more to say then. In general, I think the victim contact scheme work has been a better quality than others, has to be said.
Thanks, Helen. And we do inspect samples of victim contact scheme cases in every area. They're quite small samples, but when we go to our regional inspections, we should have enough to be able to start rating that performance, and it will be one of our new standards for regions. Certainly the VLOs I met are extremely dedicated, often been post a long time, and are really committed to working with victims and the families of victims, and the quality of work that we've seen in the victim VLO cases, I think, is generally of a reasonable standard, and people have taken notice of the lessons of the War Boys case, I think, and certainly improved on the communication there. Gwen Robinson asks, is the time right for an inspection of probation training? Well, very good point, and we will shortly be consulting on our thematic topics for next year.
Indeed, it is a topic of interest, Gwen, and it has been for some time. So soon we'll be launching our consultation. Please do respond and put your bid in.
HMRP reports maintain a significant number of practitioners are under assessing the risk posed by service users. What reassurance can the Inspectorate provide to practitioners when these statements arrived out with any direct contact with individual service users involved and without completing the same risk assessments used by practitioners? So, Simi, do you want to just give some sort of insights really into how our assistant inspectors make that judgment when we're looking at case files and doing the interview?
Yeah, of course. Thank you, Justin. When we look at each individual case, we have a set standards and wording of the key questions that we will look at. We also have internal guidance that we have published on our website in terms of what sufficient looks like in terms of carrying out risk assessment. We look at the index offence itself. We also would expect people to look at the other information that's around, so previous behaviours, previous convictions, other known information, particularly information that's held by other agencies. And there might be a range of different places that they can get information from, and that could be through home visits, talking to people that are close to the individual or people that are considered a significant person in their life. And what we're asking inspectors to look for is to what extent has all the relevant information been considered, and to what extent has that been analysed on an individual basis. Sometimes we can see that a process-driven behaviour is being carried out, or almost a tick box exercise to say certain things have been done or certain information has been requested, but it's drawing that all together to allow a sufficient and full assessment to be made. Sometimes when we have found that, for example, information has been received, that it then isn't understood or analysed sufficiently, and it leaves a gap, therefore, in terms of understanding all of the risk factors or all of the things that might contribute towards assessing the risk. Those kind of things can often lead to a misrepresentation of the risk, particularly understanding how imminent something is likely to happen, or the assessment of the protective or strength factors that might exist as well. So we look at them in terms of under assessment, under planning, implementation and delivery and reviewing, how well under each of those sections has a risk of harm been assessed, planned for, managed and delivered as well.
Thanks, Simi. Eleanor Surridge asked a question. Following on from Mike Nellis's observation about the impact of organisational reform, how local is local within the recommendation of returning to local provision? The inspections will have had the opportunity to explore delivery at PDU and regional levels throughout England and Wales. And so in the request to return to local, do you see this as empowering the existing PDU model, or onto the pre-TR trusts, or drawing of different local boundaries? I mean, that's a really good point, Eleanor. I think that would be exactly what an independent review would need to look at. What would be the most suitable boundaries to think about? Clearly, there were 35 probation trusts. I think there might have been 42 probation boards before that. In its very early days, probation was very, very local. It was just around a local magistrate's court. My memory of probation trusts was that the reason they were less of them than there were boards was it was felt that some of the smaller board areas were difficult to justify in terms of efficiencies, and that was why you had a rationalisation. There were 21 CRC areas. There'll be interesting learning from some of those. I mean, my instinct is that whatever the local is, it's definitely more local than the big regions that 1HMPPS structures are now creating, which will contain very large numbers of local authorities and police force areas, and therefore will be very difficult to stimulate the sort of genuinely local partnerships that probation, I think, needs with local councils, with children's services, with local voluntary sector to partners. But that is a key point. So the other point I wanted to make was Mike Nellis talking about, do we really want to go through another massive structural reorganisation and the impact that will have? And I think I was very careful to say in my introductory essay that whatever happens, it has to be with the explicit consent and agreement of local staff and local managers. If their view was that they would definitely want to be more local, and I think that voice needs to be listened to. I mean, I can quite understand why in the middle of a pandemic lockdown period, and the realization that what was going to be a procurement, a re-procurement of CRC type services had to be cancelled, because there's no way of running a procurement where you didn't know what impact the pandemic was going to have. That maybe the most straightforward way of going through a return to the public sector was to bring everyone into an MPS type civil service model. But I think there's still a question for me, well, actually, is that longer term the best model to be looking at? Jack Bronte, you wanted to ask a question.
Hi there, it's Bronte. Sorry. Yeah, I just wanted to raise 2 points, just to echo the points around having a localized and collaborative approach. I think if you look at the amazing work with young adults at MOPAC's Youth to Adult Transition Hub at Newham, we know that kind of innovation really works if there is funding. You say the available commission services often see high levels of referrals, particularly for housing. As a former practitioner, I felt that local and more specialised voluntary organisations were certainly not promoted from senior management, particularly for racially and minoritized people who might need a more kind of culturally specific response. And it was largely down to me as an individual practitioner to really find out about what was in my local area. So I guess just a point around, you know, hoping that there will be broadening of commissioning around the services for people on probation. Again, yeah, I'd really welcome more work around training. As you said, the role of the practitioner is not clear. You're the enforcer, you're the referrer. Sorry, my dog's just barking. 1 second. Sorry, you're the you're the enforcer, the referrer.
Yeah.
Risk, you're a counsellor essentially, but you're not trained in that. And the resources and training, particularly around kind of neurodiversity, mental health, care leavers, are just not there. You know, the monitoring of this is, you have to do that on the system, but it just becomes a sort of tick box exercise, and there's little done to respond to that data because the resources and training around those issues aren't sufficient.
Thanks, Bronte. Sorry, I got your name wrong there. Yeah, I mean, you raised on the commissioning point, you raised a really important point about the role of smaller specialist voluntary sector organisations and how the centrally run CRS commissioning process, I think, meant that those were sort of squeezed out of the commissioning process because the contract areas were too big for those organisations to take on. We in our race equality thematic identified a particular gap in the range of specialist services available from exactly those sort of small organisations locally, and if anything, the situation seems to have got worse. I think with our re-inspection, I think we only found one area where there was such a specialist service. And your other point about local practitioners making the effort to find out what's available locally anyway, again, we found people weren't referring to the services that they could have done. So I'm really pleased to hear that you've made the effort to find out what those services are and to use them. Victoria Black making a point in relation to PQIP pathways. In trust days, trainees are required to stay for 2 years post qualification. If they were to leave prior to that, they're required to pay back part of their training or uni expenses, and this made a big difference to retaining staff. Some trainees get free qualifications or degree and then leave. Slightly controversial point there, but I think that's an interesting point. I think that the point more for me is about the limited range of experience that PQIPs now seem to get in terms of the different functions that probation performs, and then being pushed into a sort of sentence management role immediately without the chance to try other things out. One of the interesting things I saw when we inspected Southwest probation recently was they've reintroduced the chance for PQIPs to spend some time working with interventions teams and programs teams, and also some time in prison. And I think opportunities for PQITs to rotate around those different functions, I think will give them a better feel for the skills that they need, and might help to retain people, because you get more of a varied experience as well. So here, the question from Ian Lawrence again. Justin, plans to disband divisional sex offender units and the impact on the supervision of sex offender supervision is a major concern. Are programs and interventions an item of consideration for the Inspectorate? And thank you for your thanks, Ian. So we do, it is part of our local inspection methodology that we do look at the quality of services and interventions being offered, including delivery of accredited programs, both for sex offenders and others. And we'll continue to look at that in our new program as well. And we also consider that topic when we're looking at our thematic programs. And research as well,
So yes, Ian, our research programme has currently got a piece of work looking at interventions, which we may then, following consultation, look at doing a specific targeted thematic inspection to look in particular at interventions.
Right, I think, have we got any more questions? I know, thanks to everyone for all of your questions. Are there any in the chat line that I haven't answered that people have noticed? I think I've tried to cover most of them. I'm hoping people feel we have answered your questions. So I think, thank you to everyone who's dialed in today. Lots of great questions and observations. I hope you found the presentation an interesting one. Do read the full report. There's lots of more stuff in that, and do have a look at the thematic inspections that we published, not just this year, but in my time as Chief Inspector as well, particularly that very important one about mental health. But we've also done thematics on accommodation provision, on drug services,
20 other topics.
and 20 other topics, I'm being reminded. Thank you all very much. I shall miss my time as Chief Inspector. It's been a really satisfying period for me. My thanks to all of my colleagues in the Inspectorate. They've been a great team to work for, both on our inspection side, but also a really great team of headquarters staff. You will be told in due course about the name of my successor. The recruitment process is in train at the moment, but I wish them well as well. And thank you all for dialing in today.